it's good to have you on the programme again, Una. I mean, have you had to turn a patient away, or do you know colleagues who've been in this situation?
Yes, it's very difficult when you ask a patient to make a follow-up appointment and then they turn around and say, well, I can't make a follow-up appointment for 3 weeks. And actually, you need to see them next week. You need to follow up closely. So it is a problem.
So you've had personal experience with this. Invariably, what happens to that patient?
Well, it puts both the patient and the GP at risk because it's not best care.
Right, okay, so that patient will then have to wait, what, 2 weeks, 3 weeks to get an appointment, and in your opinion, that's too long a period of time to wait?
It may be too long if it's an acute problem, but you need to monitor that patient closely.
Because I suppose, what are the risks to that patient if they don't get to see their GP sooner?
That's why I'm trying to educate the public to think outside of the box if they can't see their GP, because there is an acute shortage of GPs. To Google and look at walk-in centres, NHS and private walk-in centres.
I suppose ideally you don't want that to happen. You want people to see their GP when they want. What needs to happen, and how many GPs are needed, and how much money is needed, Una?
The problem is that at the moment young doctors don't want to be GPs. This country trains 3,000 GPs a year. Right now there are 451 vacant places. It's going to impact on the profession and on surgeries, and a lot of GPs are leaving to go to Australia or retiring.
Why? Why is that happening?
Because the government is scapegoating GPs. They're seeing daily bashing of GPs. They're taking away public funding, and you can't run a surgery if they take away minimum practice income guarantees, and then the GPs have to run a business with half the income.
The government say there's been 1,000 new GPs in the last 4 years. There's millions of pounds coming on tap for investment, and you're a pretty well-paid bunch of people, they say. What do you say to that?
Well, I have to correct that because that is all propaganda. What they've done is they've taken away income. So GPs used to make £100,000 to £150,000 10 years ago, but now they've seen their income drop to £78,000.
Do you consider yourself badly paid?
When you compare it to other professions like MPs, you might say, oh, well, that's quite good. But then you look at GPs, they have to pay medical indemnity, so that's another £7,000. They have to pay GMC fees, they have to pay national insurance, they have to pay their employees, etc. And then suddenly the income goes down, down, down. And now young doctors will be saddled with an £83,000 student loan for 5 years at medical school. They then look at their hospital consultants or their colleagues and see, oh, well, they can supplement their income with private income. And that's what I'm saying to government, allow GPs to become like dentists.
Okay, Una Coles, thank you very much for your thoughts this evening.